So adapting the base plate material for the lower is very much the same technique. You're going to start out from the middle and work your way out. And this time around, I didn't use any pencil lines to indicate where I need to cut it back. I'll use more of a feel with my blade to ensure that I'm all the way to the deepest part of the vestibule. So unlike the upper where I thinned it out on the facial aspect of the ridge, now I'm going to thin it right on top. So I'm going to put some extra pressure right on top of it and maybe a little bit facially to the interior portion right here, where I anticipate interference with my setup. So on the lingual side, once again, I'm going to take some material and pinch it towards the inside as to not to thin it out. Especially here where you have the severe undercut, make sure you push some material over and maintain the thickness as much as you can. So I'm just going to feel with my blade. Try not to put too much pressure because you're going to end up scoring your model, especially if you're using a fresh blade. Heat up my blade a little bit so it glides through the material a little bit easier with less resistance. And I'll remove this little bit here. So we have that effect. Remove some of the excess material that peeled away. And you want to make sure that you are clear of the edge of the land area because you want some room in there to flow some wax. Just like we did on the maxilla. So right there's a little bit of room that I can flow some wax in there to make the peripheries nice and smooth and rounded as if it was the finished product in acrylic, although it's not. And that just adds patient comfort, and I think when they're comfortable, they work a little bit better with you. And it builds up patient confidence too, because nothing feels rough, nothing is hurting. So right back here, I'm going to continue over the richer molar pad. I'll stop here and see how far I get with this. Notice that over the richer molar pad, I go right to the edge. I don't leave room for wax there because if you do, the little bit of wax that you're going to put back there, I think it's just going to peel off. So make it a habit of just going right to the edge back here, but tapering it towards the model. You can see that I'm putting pressure here and tapering it, give it a nice smooth finish towards the model. And as you're cutting through the material, you can feel your blade having a bit of a resistance as it cools off. So you have to go back and heat it and put it back and continue to the next section. If you notice back here, as I was cutting it, I created a little bit of space. You need to go back in and readapt the material for obvious reasons that we mentioned already. Little piece of stone there I got to remove. And finally, we're going to clear the frenal attachments. I know these ones have a bit of a distal inclination, so I'm going to open it up like that. And at the same time, I want to round off this corner with my spatula and open up the frenum just slightly more. Go back and readapt to allow room for the wax to flow in there, because I want to create that clearance in wax as well. So a little more relief in the base plate and a little less in the wax. I'm going to open this one up too. No different than we used to do it with our custom trays. A little excessive on this one, but let's go back and readapt and close that up. So a lot of forgiveness in the material on how you manipulate it. And finally, we'll do the left buccal frenum here. Clean off some of the excess material again. And round off the frenums. So there's very little trimming to do. We're going to do some, but let's minimize it. Now this, you don't have to go back and kind of polish it with your hand like I did on the upper, on the palette, because everything is going to be covered in wax. So we can create that nice smooth finish in wax. Just make sure that you have adequate space between the base plate and the edge of the land area, which is here on the lingual. Same thing on the other side. And here on the facial. So I have that space in there that I'm going to fill up with wax. Just a final check here. And this goes a long way to ensure that you have good adaptation of the material to minimize the work in the clinic. So I'm going to put this back in the light cure unit for 2 minutes, let it cure, remove it, put it back in upside down for another 30 seconds. And once we've done that, we're going to boil off the wax, the block out wax, and readapt the base plates back onto the master cast so we can move on to the next phase, which is applying the occlusal rim on the on the lower as well as the upper. Now this one here has cured already, so you can use an instrument. Be careful not to damage the model, and if you did your block out properly, this should just pry right off very gently. This particular case, we don't have excessive undercuts, so this came out rather nicely. There's a little bit of hint of the pencil that I was telling you earlier, but not too bad. So this has to go back in for another 30 seconds. And you can see where I thinned it out to minimize some of the interference I'm going to have when setting up the teeth later on.